Welcome to all of you in the Caribbean territory and beyond. I am Dr. Mariam Abdul-Richards on location in Trinidad and Tobago. You are watching the all-new season of Caribbean Medical TV, where we connect on a deeper level and explore all things health and wellness throughout the region. The Caribbean occupies a unique space in the global landscape. We are a small but mighty consortium of diversity, authenticity, culture and knowledge, lush with a history that spans the four corners of the globe. Nowhere else in the world can boast of such a rich tapestry of ethnicities, flavors, and exotic wonders. This is a program of the people, where the heart is truly a rhythm that matches our indelible spirit. Over the next few months, we will delve into topical issues and explore your questions to gain a regional perspective of our past, present, and future health and wellness journey. We will hear from diverse specialists in multiple islands while also highlighting the personal journey at home. Join us as we explore this new realm on Caribbean Medical TV.
The last few years have been extremely challenging, physically, mentally, and spiritually, as families across our Caribbean have been affected by the global pandemic. The good news is that despite the many threats we face, there is always hope, and we are surrounded by many success stories. We will meet the survivors of COVID-19 and other illnesses and share their stories.
How did you enter oncology nursing? What was your story?
My story. Okay, first of all, I'd say I am a survivor. I was diagnosed in March of 2007 with colon cancer. I had surgery, I had left hemicolectomy with anastomosis, and everything was okay. And I started treatment in July of 2007. During the treatment, I said to the oncology nurse, I want to come over to help. I want to come over to the department. So when I finished treatment in 2008, I was sent over to the department. I said, I want to be there because I want to express my feelings and what I've been through with the patients. Let them know that I've been part of it. I am part of it. And how I went through, there is hope. I was able to relate to them what they're going through, and able to tell them, well, let's go up. We're not going to stay down here. We're going to rise. There is life. There is hope.
I'm Dr. Althea Carr-Stewart, a pulmonologist in Jamaica, and I'm just so grateful for this opportunity for this Caribbean Medical TV series to give health education to my Caribbean people, to make them understand, make them aware of the chronic diseases, and to take an interest in their health when symptoms start that they don't understand, but this will hopefully give them a better insight into what can happen and that they'll seek medical advice early in their lives.
We live in a new world. Even with our greatest advancements, the last few years showed how much we still have to learn. The pandemic dominated the global stage, leaving no one untouched. As we forge ahead, we must look to the past to understand where we were and where we must travel.
We have not yet picked up back from COVID. We are still suffering from that backlash from COVID, and it's like, when are we going to be okay?
During the lockdowns, we were cut off from so many of our stress relieving activities. We were not allowed to go to the beach. We were not allowed to gather. We were not allowed to go to that restaurant and have that nice meal that we did not cook. Therefore, our stress just built and built and built. This would have led to a lot of people feeling that burnout once again, because you've been stressed for so many years, you've been stressed for so many months, dealing with the same things over and over again, and then all of a sudden, what do?
We have now had a lot of persons who've passed through the acute phase, and you can call it long COVID, you can call it long haulers, you can call it post-acute sequelae of COVID, or you can even call it chronic COVID. And there are lots of complaints that persons have been experiencing. I think that in terms of everyone, now is the time for you to essentially act as a barometer for yourself. What we have chosen to do is to equip persons with the information so that they can do so efficiently.
As we learn to move on, the effects still remain. Stress plays a major factor in our daily lives, but how does it manifest itself? How do we learn to manage it?
So stress can increase your risk of having things like strokes and heart attacks. Sometimes it sends up your blood pressure, sometimes we think that it causes other stress hormones to be released that can increase your risk of having one of these events. But it also has an impact in how you look after yourself, because people who are anxious or depressed, they tend not to want to do anything, which includes taking your medication, which can include going to see your doctor to know what's happening, and then exercise. Most people, when they become depressed, they don't feel to do anything, so they're not going to go to take their walk. We normally recommend half an hour a day, 5 days a week. And then also, because of what happened during COVID, especially here in Jamaica, we had a number of restrictions in terms of time that we could be out was very limited, so therefore the ability to exercise was also significantly constrained.
Heart disease, diabetes, cancer, kidney disease are all conditions that increase the risk for severe illness from COVID-19.
You're going to hear your doctor saying to you, try to incorporate some form of exercise. Try to get back to something that you would have liked doing sometime before. It's hard because when you're down and out and all you feel like doing is lying down on your couch or not getting out of bed, it takes work, right? You want to release good hormones into your system, and so you want to exercise, you want to get your heart going, you want to get your blood flowing, right, to ease all that sluggishness. Good, it will keep your metabolism going. Exercise can help with all of that a lot of the times.
We the people do not exist in isolation. Everything connects, aiming to work in harmony, yet even still there could be underlying issues that work against those goals. An invisible weight that restricts possibility, one that begins in the mind.
When you have mental health disorders, it does not discriminate. It knows not race, class, nothing, gender, it knows nothing. Whoever you are, you can be affected by mental health issues. And for anxiety, for example, many persons will go to the doctor, they will do a lot of labs and a lot of tests. Nothing will show up and they still can't account for what they feel and why they're feeling what they're feeling. When they do come to see us, we're like, oh, well, that's anxiety because it has all these physical manifestations as well.
We're all, as human beings, prone to being depressed and being anxious. Given the right set of circumstances, anybody can go through depression and anxiety. There are certainly people who might have more of a genetic predisposition if there's a family history of depression, but we're all prone to it. And there's nothing to be ashamed of. It is not something to be stigmatized, which unfortunately is the situation in the Caribbean. So oftentimes, people would rather come to me as an internist with shortness of breath or with feeling off or whatever it is than go to a psychiatrist because it's somewhat stigmatized to do that. Mental health is critically important. It affects our functioning, it affects our relationships, it affects our success at just about everything we do.
Thank you, Dr. Swebe. On Caribbean Medical, our intention is to give professional advice and focus on the physical and emotional impact that this has on our lives and the challenges related to mental health, domestic violence, and the increase in suicides amongst our youth regionally. It is a major issue that requires help on all fronts, from not just the medical fraternity, but social workers and the family too.
There are some factors that we are to be aware of. I mean, it's not only from the standpoint of the Grenadian society, but I believe it's across the Caribbean and even the world. There must be coping skills, and families must be made aware. We also have situations where families are really not aware of the situation, so they deal with it, in isolation, or sometimes they isolate themselves totally. So that particular family member, they may say to them, you're on your own. So one of the things we have to remember is the sensitization of families.
Thank you, Father Edward Mark, for your contribution to the communities in Grenada and the Caribbean.
I can see clearly. At Guardian Group, we've seen so many of our customers achieve great things. From key moments when together we've planned for the future to those unforgettable days when you've celebrated the rewards of those great decisions. So, it's no surprise that after 175 years, our optimism is stronger than ever. Because when you've partnered with people to achieve their best lives as long as we have, you tend to see the world a little brighter every day. Guardian Group. Live easy.
We stand now from a better informed viewpoint, reaching far greater than societies before. Each day there is still something new to learn, a way to better our health and wellness, our mental state and our lifestyle. The Caribbean is rich in its tales, but we must also be rich on acting upon the lessons all around us.
So I'm seeing more people exercising, but we still need to educate the rest of the population so that we have much more people exercising and adopting healthy lifestyle. One of the key things is educating our population more, because an educated population is enlightened.
Most persons come in when they are sick, and we would like for them to come in even before you are sick. Don't wait until you have a headache, a backache, or you figure, you have pain behind your neck, or you find your eyes feeling broad or something like that. We want persons to come in and have an annual check. That is taking care of self.
How true. We have to be more proactive in our goal towards being healthy. Take, for example, prostate cancer. It's a serious threat throughout our region, which for many men is a sore topic, but taking responsibility is critical.
Now, I always say that if a man dies from prostate cancer that spread to his bone, he has been a slack man, because he could have made a difference. And it's so simple to make that difference. We have our health, our good health is our responsibility, not your wives or your doctors or anybody else. Your wives will support you, but the buck stops with you. It's your life. It's very important to have an annual prostate exam, because what is little known that one of the highest incidence of prostate cancer in the world is right here in the Caribbean. In fact, Trinidad and Tobago, especially Tobago, has the second highest per capita ratio of prostate cancer in the world. Jamaica also has a very high incidence.
We'll hear more from Dr. Lal Sao on subsequent programs as we deal with cancer in full detail. Diabetes is also quite prevalent, as many people who have diabetes often don't know about it for many years, all because of a lack of awareness or not recognizing the signs.
I'm going to give you some good news and I'm going to give you some bad news, but let me start with the bad first. The burden of diabetes in this country is the heaviest it has ever been in our history. And whereas the common form of diabetes, type 2 diabetes, was a disease of older people, it's now emerged that it's very common in middle age and becoming increasingly common among our children. And you might wonder what's driving this process, what's driving this evolution, what's driving the change. It's a simple factor. We are gaining too much weight, and we're gaining that weight earlier in our life. Obesity is the forerunner, diabetes is a consequence, and heart disease is the successor. So they run one into another. Because obesity is the forerunner, if we could specifically target obesity, we prevent diabetes, we prevent heart disease, and we can prevent a dozen cancers. That's the good news.
Certainly from my perspective, prevention is where we should be focusing. And, we all have heard as a child growing up, an ounce of prevention is worth a pound of cure. That is certainly so for diabetes, because it's actually a lot less costly to try to prevent diabetes than it is to deal with the complications, after the horse has bolted, so to speak.
It's about 15% of the adult population in Guyana has diabetes. So There are many more that is undetected, and that's due to lack of screening, and it's because of some people, they feel they're very healthy and they don't go very regular for checkups. So when anyone who is experiencing frequent urination, frequent thirst, frequent hunger, blurred vision, if they have a sore or ulcer that is taking a long time to heal, tiredness, listlessness, then it's always recommended to go to your professional healthcare provider and have them screen you for diabetes.
In our organization, we engage quite a bit in what we call CSR, or Power to Make a Difference program, and our Power to Make a Difference program actually touches on quite a bit as well of what the sustainability and the equity goals aligned to these principles of responsible banking are all about. But it's so much more. As we go forward at the group level, it is our intention to spread this out, to let Republic Bank maybe be the cheerleader for this initiative in the Caribbean.
Non-communicable diseases are prevalent not just here, but around the world. We are not alone in this fight. But while it is well known, there are things we should know to be better informed. And so that trip to the doctor's office is not meant just for critical risk situations, but to seek understanding, as there are so many myths that can easily be explained.
A lot of us have a feeling, or we go along with this myth, that we grow out asthma. We had asthma as a child, and then we feel that coming on into our adult years, I haven't had an attack for a while, so I've grown out the asthma. That's our myth. If the airways of that particular person is exposed to the right allergen, they will go into a serious asthma attack. And that asthma attack can be so severe, it may require ICU admission. A lot of the times, it doesn't matter the level of education, the technique for the inhaler is wrong. So part of your interview with that patient, or part of your consultation, whether it is in a clinic or in your office, is to go over the inhaler technique to make sure it's right, so the patient is well taken care of.
We look forward to chatting further with Dr. Akar Stewart of Jamaica and her Caribbean colleagues about the signs and symptoms of asthma and what methods we can use to maintain and improve the quality of life in upcoming programs on the Caribbean Medical Series. There is no doubt that we are living in a fast-paced world, and we sometimes take our bodies for granted, inflicting additional and unnecessary work on our organs with catastrophic effect. Kidney disease is one such illness that we all need to take more seriously.
In the initial stages, when I started the dialysis, I used to feel very sick. All in all, I'm here. I shouldn't say, I should say I'm comfortable, but people shouldn't really get comfortable with something like this. It happens, you don't have to be as old as I am, because this attacks people very, very young. So I'd like to encourage them to eat right. Just take good care of your body, because there's times your body tells you, your body gives you signals that things are not going right, and we don't always listen to it until the worst has happened. So in order to save the generation that is coming, we have to educate young people, we have to educate everybody.
I went to Guyana under an arrangement, so it was easy for me. And I am very happy from being in the hospital in Guyana, as a doctor myself, being able to observe their standard of care. I was very pleased, and I consider their service to be so good that I returned to Grenada and lobbied so that we can have more patients going to Guyana and getting the same services that I received, as well as having our own doctors go to Guyana to receive training is another thing that I'm lobbying for. So that again is going to help outside of the patients. Even getting doctors moving between the countries is also going to work towards medical tourism. And in terms of our cultures, even though we have things that are different, because we're one Caribbean community, there's a lot of similarities. So it's very easy to adapt.
The hardworking medical staff of the Caribbean are our unsung heroes. They consistently meet the challenges, never stop caring and nursing the sick, and we salute them for the high standards that they set.
Our standard of surgery in the Caribbean has always been, even from my student days, good, but now it's at a level that is just incredible. And I'm only talking about surgery, but the staffing, when I look at the energy that took place in the COVID, it was just wonderful.
Caribbean Medical TV would like to recognize and highlight the invaluable and incredible contributions of our medical teams across the region. From our nurses and all associated categories of nursing personnel, to our ambulance drivers, our allied healthcare professionals, such as our dietitians, laboratory technicians, and radiology technicians, our doctors, and of course, the administrative staff that support the health sector, we thank you.
The sharing of information is what this series is all about. We would like that Caribbean Medical can cater to every chord of our Caribbean society, exciting within our people a desire to know more about their health. Caribbean Medical TV aims to empower our people with knowledge, creating a desire to know more about your health and the particular problems and challenges that affect us all. And in so doing, we can rejuvenate our spirit. It aims in its own special way to save lives.
My job is a failure of the society. Here again, we can recommend what is the control of the risk factors. Risk factors mainly are the disease that can increase the risk of coronary disease. And these are diabetic, hypertension, high cholesterol.
There was a time when the people of the Caribbean, you ate what you produced. You lived off the land. We walked from place to place. Now, we drive from place to place. We breathe in the carbon monoxide from exhaust fumes as we are stuck in traffic. And we're consumed with jobs that are short on manpower, so we have to work longer hours. And so what happens?
So my plea would be for all of us now to go to that area of the room and pull the nutritionist to play a central role. My role is to keep monitoring you for the medication I put you on, looking out you don't have the side effects. Stay away from fried and fatty foods, cut down your dairy products. Yes, you can have a glass of wine and eat fresh fruits and vegetables. But the person who is going to give you the details of how much of what you should be eating, they're still in the pavilion, and we need to get those people involved.
A dietitian basically has understanding of the body, the way it works in terms of collaboration with food and how it impacts the body. So a dietitian looks at laboratory values just like any other clinician would look at laboratory values based on the disease that the person is presenting with. Because we know that people go to physicians and they get medication, and sometimes they're on medication for many, many years, but they have never seen a dietitian, they've never seen a nutritionist, and that's the component that is missing in giving them that holistic care so that they can have the better outcomes, so that the medications can work better.
We can appeal to people and tell them to do the right things, have the right diet, exercise. We have an exercise prescription that everybody should get a minimum of 150 minutes of exercise a week. But it's been shown that you have to have policies, government policies, that support that message of prevention. So our environment has to be conducive to people exercising. Our environment needs to be conducive to making healthier foods available. And we need to have, in some cases, legislation has been shown to work, and legislation on sugar-sweetened beverages. That's a big topic in Barbados right now, actually.
Living healthy is not just a trend, it is a movement to increase our chances of a better, healthier lifestyle. Being united in knowledge is a key element of the Caribbean to combat not just COVID-19, but non-communicable diseases, which we will explore further in the upcoming episodes of Caribbean Medical TV.
So if there's one thing that I could encourage each and every one of you to do is really to empower yourselves. Have that conversation with your doctor. Know what is normal blood pressure, what's normal blood sugar, first thing in the morning versus after a meal. Know your numbers.
The thing about prevention is that the burden of prevention still rests on the patient. So we are hoping that with programs like yours, in which you educate the public about the risk factors for disease, then they take it on, because the doctor cannot get up and go and exercise with you. The doctor cannot stop you from smoking. The doctor cannot extract your sweet tooth. All of these are things, the burden of which rests solely on the patient. And they've got to make the time to do that.
Thank you, Dr. Massey, and all of our other Caribbean medical doctors. As usual, we encourage you to be aware, to be proactive, and take steps to protect your health. Talk to your doctor and evaluate aspects of your diet and the amount of exercise you get. We hope that this program will provide you with the necessary tools to improve the quality of your health and lifestyle. I am Dr. Mariam Abdul Richards, and this has been Caribbean Medical TV.